is many times a person with a brilliant idea comes in and they perhaps have had their experience, but not every patient is the same. Not every diabetic is the same. Not every hypertensive is the same. Every hypertensive patient is the same. There are different requirements. They come from different backgrounds, different socioeconomic statuses, different family support structures.
Um, this question of like, where do users come in? And this question about deployment, I think that that's really important to talk about, especially within the context of AI, because we've already seen that models that are trained on a certain type of data, so say the data is not representative, um, it just won't work for the people it wasn't trained for. And there's no easy fixes once you've already kind of made those errors really early in the process. And, it's also important with devices or technologies that are relying on unsupervised learning, and the amount that they can change or fluctuate. Something might seem equitable and fair and like it works for all of the different stakeholders at one point in time, and then that might not be the case. So there's also kind of like, when it comes to maintaining trust, there's also these issues of, you know, governance and kind of continuing to bring people in and to monitor how effectively the tech works for different folks.
you know People come from a lot of different backgrounds, so they're receptive, they could or could not be receptive to technologies based on their backgrounds. And it's important to respect and understand where people come from when it comes to technology, be it their race or even age, gender. These can all affect people's how receptive they are to technologies. Just today, I was reading an article about how these AI systems were being trained on patient scans without their consent, from ER. So, those kind of stories are going to further enforce the mistrust that patients may have, not only in the healthcare system, but also in the development of these technologies. So it's super important that we come in at the ground level when developing these technologies with patient trust in mind, making sure that from an ethics standpoint, we are getting the consent, that we are including the patient voices and the clinician voices as we develop these technologies.
Tony Marie spoke about biases. There was a 2019 study that, especially against African Americans, there was bias against because of AI algorithms. So, do we understand that there is going to be biases in these algorithms that I'm knowing? So, all of this communicating, transparency, and explainability, we should be able to explain that and show that information to our patients. And we have to remember, we're at the beginning of this. So, it's going to take a bit of time, but if we do the steps properly, it'll be beneficial for everyone.